Pop, can you hear me?
Sure.
I cannot hear you at all. Wait.
Can you
Say
hear me
something
now?
so I'll be sure. I see you're saying something, but I don't have a sound at all. Just a second. But you can hear me, right? Make a sign that you do hear me. Right, you do hear me. Just wait, we will make a sound so that I can hear you. And while I can't hear you, tell me, do we have the slides or we do not? Do we need
No,
slides? No, we will
I
be
think
just talking. And and you are one of my favorite experts in the world. So first of all, present yourself as you consider to be right.
Yeah,
And let's start discussing Serbian experience.
Okay, very good. Very pleased to be connected again with Katya and colleagues in Ukraine. We spent a lot of time together over the past years. I'm right today. We'll be talking to you about the Serbian experience with the pandemic vaccination. It was one of the really success stories because even right now, today we are the most successful country in the continental Europe, let's say behind the United Kingdom. But we are, after a very speed and a very successful start, I think we're moving into a more difficult territories. And what I would like to talk to you is about our experience, some lessons learned that you will be able to apply in your vaccination campaign and hopefully not to repeat some of the mistakes that we have done. So,
Pop, when you are saying we are very successful, it means that what in figures? How successful you are and which space in Europe?
All right. We started vaccination. First of all, we received the first vaccines in December last year. And we were among the first country in Europe to receive the vaccines. And we started campaign of the health workers before the new year. And up to now, we have something about 22% of population covered with 2 doses and about close to 30, let's say, and 10% of population more covered with the 1 dose of vaccines. So let's say within the next couple of weeks, we're going to reach the 30% of overall population, which is one of the best results in Europe, let me say, unfortunately, because I was expecting that all countries will be doing much better than that it's happened.
Tell me, why did you start early? Which steps the government took to have products available? And which products were available in the beginning and which products are available now for the vaccination?
Yeah, I think the most successful element in the whole vaccination campaign was basically vaccine procurement. And I have to say that the government was extremely active since mid of 2020. They have, first of all, joined at that time international partnerships, including CEPI. The government of Serbia twice have some donations into the Fund for Innovations. And I think, you know, they have established a good communication with the manufacturers and with the coordination mechanism. That was one part of a success. The another part was basically extremely, I would say, successful role of a president and a cabinet who basically used his political connections, primarily with Russia and with China, so that we already in December 2020 we received the first dose of Pfizer vaccines as well as a Chinese vaccine, so that we could start the mass campaign.
And who was the first target of them?
Later on, we received the AstraZeneca as well as Sputnik V. The target was the same as WHO is recommending. We started with the health workers and then with the population 75 plus. Actually, the start was with the population in the homes for elderly. And then we were kind of trying to cover the first population with the chronic diseases and with some other health conditions. But then soon we have started covering younger population, but that's something I would speak later more in detail.
So if we step back, do I understand correct that you have at the same time Pfizer, Sputnik V, some Chinese vaccine, and AstraZeneca vaccine, correct? Or even more vaccines?
That's absolutely correct. And you know, we were until the last week the only country having those 4 vaccines, and there is a let's say a good element, and there's a risk element into that. First of all, I mean, it's good to have as many vaccines as you can, simply because obviously vaccine supply is a huge bottleneck for most of the countries. We need all effective and safe vaccines. The second, and I think that was, this is my personal view, but you know, from the beginning, a government sort of offered to population to choose between the 4 available vaccines. In fact, they have offered population to choose between the 6, but we still didn't receive any Moderna vaccine, though there is a pre-contract with the Moderna. Not we received any Johnson & Johnson vaccines yet, but soon they may also be available. Why the choice is problematic? I mean, first of all, general population doesn't have a knowledge nor arguments to select, to choose between the different vaccines. The second issue is it's a really logistic nightmare. It's a very difficult that you have, that you organize a campaign in a sense that you have all vaccines available in all vaccination points. That's almost impossible. And second, and the last thing is basically when you start selecting between the vaccines, you inevitably get into some kind of public debate that goes deep down into the nitties and gritties around the vaccines. You inevitably getting some of the misinformation, some of the misconceptions around that. And I'm afraid that this kind of selection by non-professional people would lead to some kind of risk for reputation of some of the vaccines. It didn't happen yet, but I think that risk is quite possible.
2 questions with that. Do I understand correct that even now people of Serbia can choose the vaccine they want, or it was in the beginning and now it's not the case? And the second question on the same topic, whether healthcare workers were choosing or not? And if yes, what were they choosing?
I think it's a two extremely important questions, let me start first by explaining the process of vaccination itself. I think from the beginning we had this e-governance system, which is the electronic platform that is used for the e-governance, so you can get some documents through, you get some information from the government, and that system is much stronger than anything that we have in a health system. So I think was a wise decision of the government to use that system for the recording and reporting on vaccination, as well as what is extremely important in the case of COVID vaccination. We were using that system to create the certificate of vaccination that tomorrow can be used as a sort of a vaccine passport or whatever. So the procedure was as such. You can access this system either through your computer or through your mobile phone. You put your name, you put your address, you put your basic data, and then you have the second menu is basically you can select which vaccine you prefer among those 6. Or you can say, I don't care, I will take any vaccine available at the moment. Many people who were selecting some specific vaccines were waiting more, simply because it was not always possible to have all vaccines available at the time people are coming. The second issue, as I mentioned, was basically many people were not selecting any, and obviously they were getting faster to the vaccines, and they were more easily completing the whole process. The good piece of that system is that the vaccine certificate is in an electronic or a paper form, but you get the QR code that anybody can scan, and by scanning your code, you immediately get your official certificate, which I think it's about the same format of those electronic vaccination passports that are circulating around. So that's a good part of that system. The bad part of a system is that it's a passive. And in the beginning, we were obviously having the early responders and those people who are really concerned for their health, and people who were believing in the vaccines, and people who wanted to vaccinate themselves as soon as possible. So first 20% were going pretty fast and pretty easy. Now we are getting into a situation where we need to really reach those who are either hesitant or, you know, those people who for any reasons don't have access to this electronic platform, you know, like some elderly people, some people in rural areas, and so and so. Now on your questions with the health workers, I mean, I have to say, health workers are absolutely the major challenge. We were following and this is not the situation just in Serbia. We were following the advice from WHO to start with vaccination of the health workers. And as I mentioned, you know, we had the vaccines, but the coverage was not more than 30% among the health workers. And the reasons they were choosing for not being vaccinated goes from A to Z. And basically, I'm very concerned with a lot of misconceptions, a lot of conspiracy theories that are coming from the health arena. We have, of course, pandemic and the vaccination is in the focus of the media all over the country. But, at the same time, you see a number of health workers that are very counterproductive, and there's a huge challenge on how to deal with that sort of situation.
Do you see any difference between groups of healthcare workers? Because what we see in Ukraine, for example, those who work in emergency in the ambulance basically system, they have the lowest percentage of the coverage. Those who work in the COVID hospitals, they have very low coverage. The primary healthcare wants to get it a little bit more. Do you see any difference in the groups of healthcare workers in Serbia? And of course, university professors do not want to get vaccinated in Ukraine, as you can imagine.
I think what we have globally with the COVID vaccination is that this is the first time all health workers are concerned with the vaccination. And it's not just the pediatrician that we usually have, or the epidemiologists, or primary healthcare physicians. It's all groups. And within those groups, you have very different sets of questions, so very different sets of concerns. I started recently going around the country and doing some kind of public discussions with the health workers. In some of the municipalities, you get majority of, for example, gynecologists and obstetricians, and they have a zillions of questions about how you get infertile after the COVID vaccination, or how can you deal with this or that related to your reproductive health. Not to mention issue of vaccination and the breastfeeding, or vaccination and pregnancy. At the same time, in other municipalities, you talk to the people who are taking care of the elderly population with the chronic diseases. In some of the municipalities, you have allergologists, immunologists who are making all sort of theories around autoimmune diseases and vaccination. So the fact that so many health workers are engaged in this vaccination is a huge challenge, and we need to make sure that our communication with a very simple targeted messages is reaching those specific groups. Of course, it's not happening right now in Serbia. We're trying to do something, but it's a major issue.
Let's go back to the passivity of the system. You said that the person can register online, choose the vaccine, then what he or she will get SMS or email on where to go get the vaccine, correct?
That's correct.
Is there a role of the primary healthcare physician or nurse in this process, or none? Basically, is it the active approach that you will be called from your family physician and reminded that you haven't got your vaccine? And was it there from the beginning, or it appeared later?
Well, let's say we started with what you right now described, Katya. So you subscribe to the vaccine, and then the original idea was that your doctor, your chosen doctor, will contact you, or you will get information through this electronic system that will be coordinated with your local doctor. But then soon we realized that in a pandemic conditions, you can do that. simply because of the physical access to the primary health care that is, of course, constrained, and you need to follow all of these other precautionary measures. So really soon, within the 2 weeks, we have outposted the whole vaccination from the primary healthcare units in the cities, and we developed a makeshift mass vaccination points, whether in a sports halls or in some of the public facilities. So in Serbia, in Belgrade, for example, there is a major sports arena. They have, I think, 80 plus immunization booths within the same arena. So they can they can vaccinate 80 plus people at the same time. So the process goes, it's a really industrial kind of way of operation. Everything goes smooth and quick. After you get your vaccine, you go into another waiting room. You wait for another 50 to 20 minutes. If there is nothing happening, you go home. That was a good example, and I think it helped a lot to meet this first wave of public demand. However,
in these vaccination points, before you go ahead, did you have doctors, or it's first of all nurses? And did you request from people to have any blood tests, antibodies tests, or any other tests prior to this immunization?
Yeah, no, yeah. All right. So the vaccination, well, when you enter the vaccination space, the first people you're going to meet are those who will take your personal data and enter your data into the system if you didn't do it by yourself. The second is you have a quick interview with the doctor, who is basically asking you about the general contraindications, a few questions about your health, some kind of history of anaphylactic reactions or any reactions to the vaccines or any component of the vaccine. You sign the paper, your doctor signed the paper, and then you move in the area where you have a booth where the nurse is giving vaccines, administering. They are separated. They totally following the precautionary measures in terms of masks, scaphanders, whatever, all these kind of necessary measures to protect themselves as well as to protect those who are vaccinated. And they have, of course, anti-shock therapy at the spot. And as I said, as soon as you are done, you move to the another waiting area where, again, by following all precautionary measures, you wait for another 50 to 20 minutes and you can go home. So that's about it. The question of laboratory and the question about testing is a huge issue. Officially, it's not recommended, but we have a huge debate about that. Everybody is looking for, and of course, you have a private sector who are who see their own opportunity in all of this. So there is a whole frenzy about testing before vaccination as well as testing after the vaccination, which again, it's an issue that is having impact at several different levels, and no testing is officially recommended either before or after vaccination. I think that testing after vaccination could be really counterproductive, and again can fire back to the confidence in some of the vaccines. Very, very dangerous practice.
I stopped you, interrupted you at the point when you said that the first wave of public demand was satisfied by vaccination points. What happened afterwards?
Very, very good question. Thank you for that. So we had this mass vaccination points in the urban areas. We had vaccination in the rural areas at the primary healthcare institutions. But then at some point we realized that this is not enough. So the two measures are major that we introduced after, let's say, 2 months of vaccination. First, we open some of the vaccination points where you can just go and get the vaccines without any prior subscription. That helps a lot because you know, many people are really using different opportunities, or you know, just bypassing and then you know, get the vaccines. Actually, next week they're going to open some vaccination points even in a shopping malls, because they will reopen the shopping malls next week. The second thing is, we realize that that the costs of vaccination for the people in rural areas are much higher than the costs of vaccination of the people in the urban areas.
You mean not the cost which they are paying directly, but which takes government to bring the vaccine to them, correct?
Or it costs them to move to move from the village into some of the central area where they can get vaccines. They need to leave the whatever the farm, and they need to travel, and you know, that costs the money. You don't pay anything for the vaccines. That's something that is practiced everywhere. But so what we started doing is basically outreach teams that are going to some of the villages, or you know, the local communities are organizing bus transportations or whatever, you know, to bring the villagers to the vaccination points for the first dose, and do the same after several weeks when they are due for the second dose.
Mm-hmm. How did you go out of the situation with Pfizer and low temperatures and the logistics? Was it complicated, not complicated? How did it work?
I think yeah, I mean, that was a major concern, and I have to say that the government procure the Pfizer vaccines from the local Pfizer representative, and they have some kind of agreement that they help the government to keep the vaccines at the proper storage condition, as well as to distribute it. So the vaccine was in the beginning, at some point in the first days, we even had the DHL paid to help vaccine distribution, because they have a very special cars, and they have a lot of experience. They are very efficient in this kind of logistics operations. But soon, you know, we realized that it's possible to do distribution without interruption. We learned how to keep this ultra low temperature, and we were using this period of 2 days of the let's say +2 to 8 centigrade temperature to actually utilize vaccines very quickly at the primary healthcare. Fortunately, we have right now new evidence from the Pfizer that the vaccine is more thermostable than it was original information. So this gives us a bit of more relaxed situation. But I also have to say that Pfizer is about 20% it's about close to 30% of the supply that we had so far. The Chinese Sinopharm vaccine that we have is a majority when it comes to the number of doses. It's followed by AstraZeneca, and then the Sputnik is, let's say, with the least number of doses that we have. As you know, Sputnik, AstraZeneca, and the Chinese vaccines kept at the same conditions as most of the childhood vaccination.
Is the Serbia part of COVAX?
Yes, from the beginning, they were active from the beginning, and we received a first shipment from COVAX. Actually, we received that shipment almost, a kind of 2 weeks after we received first shipment from AstraZeneca produced in Serum Institute of India. So, which was good that AstraZeneca was already registered and used in the country before we got our first shipment from COVAX. The second shipment will arrive in June. I also have to say that we have 2 days back, there is a first report published about efficacy and efficiency of the vaccines in Serbia based on over 3.2 million doses given so far. And there are really pretty good data coming up. Very few adverse reactions, nothing serious, and I would say, a very good record for all vaccines. I think the only what we can see right now is that immunity after Sinopharm vaccine is building up a bit slower than after Pfizer or AstraZeneca or Sputnik vaccine. Yesterday, we have finally issued instructions to cover all pregnant women, as well as those who are breastfeeding with either Pfizer or AstraZeneca. The reason why we didn't do it for all 4 vaccines is that we simply don't have information from on the Sputnik and on Sinopharm vaccine. I mean, you know that the information are coming slower than for the other vaccines.
So what's the strategy of Serbia with regard to the vaccination of pregnant women against COVID?
Yeah. So as I said, as of yesterday, we have instruction that no pregnant woman should be refused to receive a vaccine, but we giving them either Pfizer or AstraZeneca, and we are following actually information that we received from the manufacturers, as well as from those countries where those two vaccines were already in a mass use, such as UK or the USA. Or
so
Israel.
in any terms of pregnancy?
Yeah, I mean, the general recommendation is to do it as, I mean, we have a lot of evidence that the virus is damaging for the reproductive health of a female as well as the male population. We have a lot of cases of complications with the pregnancies, with the women that are affected by virus. We were having some of the preterm deliveries, and evidence that speaks about vaccination of pregnant women is that risk of having the virus is much higher than any risk related to the vaccines.
Let's step back for the logistics once again. So who is paying and how much is paid those healthcare workers who are participating in this campaign as vaccinators, as a member of this vaccination points?
Well, I think it's a good question. I have to say, when it comes to the cost, I need to start with the costs of vaccines. I mean, we simply don't have idea about how much the government is paying for the vaccine. I would say there were a lot of requests to publish that kind of information. It's not coming, but I have to say, it seems that this, in all countries, this is kept sort of confidential. What we know is that AstraZeneca is the, let's say, the lowest price, followed by the Pfizer, and then it comes Russian Sputnik, and the Chinese vaccine is the most expensive, which to me makes no sense, but this is how it is. In terms of health workers, I mean, obviously there is a need for a huge number of health workers for the vaccination, and they are all paid by the government. Already last year, we realized that the health insurance fund will not be able to cover the costs of the pandemic response and the control of the pandemic. So I think there was a lot of infusion of funding from the state budget into the health system already in the last year that continue this year with the vaccination. All vaccines and all services related to vaccination are free of charge for the population.
So with regard to salaries or additional payments?
No, they're getting a salary, but they're getting, I mean, if they work additional shifts, they're getting money for the additional shifts. I mean, that's how it is.
Mm-hmm.
I mean, health workers received a 10% increase in salary last year. They're getting some of the bonuses, particularly those who are working in the red zones in a COVID system, you know. But I have to say, huge credit to health workers and their engagement in the whole process.
Which group is receiving the vaccine now in Serbia, and what is the closest goal for the government to cover which group, and in which terms?
Well, I mean, that's a good question. I have to say, you know, we were preparing a very detailed framework, which was very similar. I know that you had the discussions with Ido and Israel Experience. So we tried to to do the same, but in practice, we didn't close any of these priority groups. I mean, we had very low, as I mentioned, the coverage among the health workers, which to me is absolutely devastating, and I really cannot understand. I think I feel ashamed myself. We were covering a huge proportion of the 70 plus people, simply because they were properly motivated, collaborative, but we didn't cover them all, particularly not those in the rural areas. And we are now lowering the age groups that we are covering. With most problems that we have is among the younger. The group 18 to 30 is absolutely ignoring the epidemics. All research that we have is indicating that they don't want to vaccinate, and the only motivation for them to vaccinate will be if the vaccination certificate would allow them to travel. This is what we know right now. It's a huge issue. This is, again, the same population that did not adhere to the preventive measures, and they don't wear masks. They get into all kind of risks behavior. So, and that will be definitely some kind of target group to the in the future campaigns. When it comes to the infection itself, we have a still very high transmission of virus in the country. It's a bit better than 2 weeks back. But we are now, we don't see much of the effects of the vaccination. I mean, it's too early. As I mentioned, we covered 20% of people with the 2 doses. But our estimate is that as in other similar countries, we would need something over 50% of the population to be vaccinated, really to see the transmission of viruses is slowing down. Another issue that it's coming up over the past couple of weeks is that we have more and more cases among younger people and even children. So this could be also one of the maybe effects of the fact that elderly are...
Pop, I'm very sorry. What do you observe among the younger people? Because I didn't hear it.
Sorry. Transmission of virus among, and the cases of virus among young people. We see that those... we explain that by the fact that really older groups are either protected or vaccinated. So the virus is right now circulating among those populations as well, creating more problems.
What about tourism and citizens of other countries? Because we have a question from the sailor who is currently being in Belgrade and who needs to get vaccinated to go overseas. And we have several questions from people whether they come to Serbia and get vaccinated as tourists from Ukraine.
Well, I think that there was a lot of buzz around that. Some of that was just a fake news. Some of that was a result of the fact that some population from Bosnia, Northern Macedonia, or Montenegro were coming to Belgrade to get the vaccines. But that was one short period of time. In the country, we offer to cover all those who are not citizens of Serbia but are having a permanent residence in Serbia, whether it's diplomatic staff or the people working in companies here. Some people may still get the vaccines, but there's no kind of organized process. And I have to say, be careful, because there's a lot of information. There were even advertisements in the newspapers and in the media in Turkey. Agencies were selling some kind of tourist arrangements to travel 2 days to Serbia, get the vaccines and go back. I mean, it's not possible. For the cases of sailors, as if they are here, I mean, there is a possibility. There is a chamber of commerce who are dealing with all kind of cases, similar cases, let's say. So it's possible, yeah.
Now, with regard different groups, successes and coverages. First of all, people are asking, is it 30% or 20% of those who are covered in Serbia with 2 doses now? 20
no,
or 30?
We have 22% with 2 doses.
22%.
We have 10% more covered with the 1 dose of vaccines. I mean, you know that for AstraZeneca, for example, the interval is pretty long. So let's say within the 2 weeks or 3 weeks, we're going to have like 30% of population.
So the question with regard communication campaign, to be successful, sometimes you need communication campaigns, sometimes you don't. Did government finance any specific communication campaign with regard this vaccination? How much money did they invest, whether it was successful or not, and what would you do differently?
No, yeah, well, let me tell you, I think I think the organized communication campaign never been more important than with the COVID vaccination. The reason for that is simple. We had every single citizen of the country which is affected by this, and it's in a focus of attention of everybody. The government was late and non-efficient in the whole thing. I think though, for example, the World Bank offered financial support for some kind of communication campaign, the campaign never happened. And we have right now really urgent situation in which we need to boost the communication for several reasons. To bring people for immunization, and I think what is even more important is to have a strategic relations with the media, because there's so much of infodemic miscommunication around. This needs to be managed in some kind of way. And the second thing is, you know, the subjects of this misinformation are changing. So you have almost like one thing is on top of any discussions for about 2-3 weeks, and then it disappears and it's being replaced by something completely different. So you really need to counter those kind of misinformation with the proper information. The second thing, as I mentioned, we have more people engaged in vaccination than ever before. Some people who were never doing vaccines right now working in the vaccination points. They need a very simple and very clear instructions, because we observed a lot of opportunities for vaccination. many people came, oh, I have allergy on ice cream. Oh, you cannot get the vaccines, go home. You know, so this is something that really needs, I would say, as we have this mass infrastructure in place, equally important is to have a proper communication campaign in place and in the air, of course, to help people guide through the vaccination process and through the pandemics.
Tell me with regard to discussions on self-production, because in Ukraine, of course, there is a huge debate with regard the country producing now its own vaccine, giving money for the production of the vaccine. And I guess it's not only in Ukraine. So is this debate existing in Serbia? How successful it is?
Oh yeah, I mean that's the huge story. It's a very patriotic in any country you are right now is to speak about local vaccine production, but I think it's a it's a false dilemma, I would say, for and there are a couple of reasons. I mean, first of all, you know, we have right now huge needs for the vaccines. And this year, I think the need is over 10 billion doses plus 3-4 billion for the routine vaccination. So it's really huge. Next year, that demand will be under 10 billion doses. And the year after, we're going to control this pandemic and the demand will go back to the pre-pandemic situation, which means that we have explosion of the market right now, explosion of a demand, but it's a short-lived for any kind of establishing the local production process. The second thing is some of the companies are really short in supplies. I mean, the China is struggling to cover their own population. The Russia is struggling to cover their own population. The EU is in a huge crisis. And everybody is going around looking for some kind of a magic bullet, a huge production facility that would sort it out not only national needs, but the international. There is some discussions about starting production of Sputnik V in Serbia, but if you really read between the lines, they're speaking about some kind of filling and repackaging of the vaccines, and in a very small number of doses that would not make any impact, not even on the domestic market.
Tell me, do you think that this vaccine becomes seasonal or not? And what's the general global discussion, whether it will be seasonal every 2 years, or it will be long immunity for a long time, or the virus will evaporate and we will not need it because simply there will be no outbreaks? What's the current trend in this part of discussion?
There is a lot of discussions. I think we need to prioritize this, and the priority is, of course, that people get 2 doses of the available vaccines as soon as possible. We stop this pandemic, and then we observe what will happen with the coronavirus in the future. It will stay with us in some form. I mean, we still need to learn about more about that. You know, in which form it's going to stay. And then we're going to see in which form we're going to need vaccination in a post-COVID era. There are some discussions about these vaccines. There's some discussions about new COVID vaccines. There is discussions about combination of COVID and influenza vaccines. There are many options. What I would like you to to bear in mind, and I think it's a really related to your questions about immunity after vaccination. One of the big issue in the country, as I mentioned, is at some point everybody starts measuring their own immune response. It's a huge issue because people are coming out at the social media complaining they have a very low antigens,
or comparing each other's antibodies, which is hilarious, totally.
I mean, all kind of crazy scenarios, and sorry, and then the second issue is, you know, at some point. Oh, sorry,
somebody is insistive.
So somebody is calling me. Apologize. So I think what you need to be ready for, which is very important, is that really to explain the efficacy of vaccines to the population. We are saying from the beginning nothing is 100% effective. Vaccines are within the range of 79 to 95% of efficacy, which means that in 100 population, even if they are vaccinated, there is a possibility. There is a possibility that someone contract the virus after vaccination. There is a possibility to contract the virus within the process of vaccination. So between the first dose and the second dose, or immediately after the second dose, because you are not you're not fully protected in that period. So that kind of stories will appear as a kind of evidence that vaccines don't work, and you really need to be ready to provide data and evidence that this is not the case. Vaccines are 100% effective in protecting complicated cases, hospitalization of a COVID. When it comes to infection, it's a bit of a lower rate. When it comes to really spread of the virus, we still need to get the data to be able to say whether the vaccines are effective in preventing the spread of the virus. So whether this neutralizing immunity will work or not. But what is important, again, going back to this experience of Israel, is that after successful immunization, you really see drop in the cases of COVID, and you can go back to some kind of normalcy, and that's the point.
Tell me, is the debate with regard AstraZeneca and vaccine-induced thrombocytopenia and thrombosis in general big in Serbia? And did Serbia change any recommendations with regard this vaccination, moving it to other age groups or withdrawing it from the market like, for example, Denmark did? Is this debate big or not?
I think that debate was very unhealthy, and actually we were seeing spillover effects in Serbia as well from the news from Europe and the rest of the countries. I think you noted that, for example, you remember in Germany they were saying, oh, the vaccine is not effective for under 65. And then last week, Angela Merkel, she really on purpose took the AstraZeneca vaccine, you know. So there's a lot of misinformation around that. We have a good data so far. We didn't have a single case of any kind of deep vein thrombosis related to AstraZeneca vaccines so far. So there are no changes in Serbia. we're using for all 18 to over 65. So it's been very successful so far. I think the data are really very similar to the data in the UK.
In Ukraine, there is a very unhealthy debate that you cannot vaccinate those who had COVID before because it's too dangerous for them, or to immune something and something, and the speculation about this delay in the schedules of other countries, which in my understanding, the delay is related only to the limitation to access to the vaccine. So could you comment on that? Because I deliberately publicly vaccinated with Covishield because to stop a little bit, not to stop, but to kind of influence this debate, because I had severe COVID and I vaccinated after severe COVID with Covishield. So was I right or not to get vaccinated after being sick with COVID?
You're always right, and you are also right in the fact that the reason for delay in vaccination of those who had COVID was simply limitation in supplies of vaccines. The policy and what is in practice is that we vaccinate everybody who got a COVID in any kind of form 1 month, with a 1 month interval after the, let's say, the person had the disease. The reason why we keep that period of 1 month is that any kind of contact of your immune system with the virus or with the vaccine will boost your immune system. So after you had the COVID and you have vaccines, your immune system will be, if I can say so, at a much higher level than without without you passing disease. What else I need to say? Yeah, so the immunity after COVID depends on how serious disease you had. Many people, as we know, have a mild symptoms, so they cannot really rely on the immunity buildup after that experience. And this is why we see many people having more than one COVID infection. So the recommendation is really immunize everyone, and this is what is happening right now in Serbia. So regardless if you are immunized, regardless if you had the disease or not, you need to get your vaccines, and you need to keep the schedule, and the only period that you need to wait is 1 month after you had the disease.
Did you get vaccinated against COVID, and with which vaccine?
Oh yes, I was actually I was vaccinated relatively early. I was taking my mom to the hospital. She's 85, and then there was my there was my colleague there who asked me if I got a dose or not. I said, you know, I'm waiting for my turn. So she said, no, you should not wait. We have Chinese vaccines available for health workers. If you like to get a shot, you know, you can do it right now. So I took it, and I think I finished my second dose mid-February. So
you're a fully vaccinated person?
I'm fully vaccinated so far. I mean, there is, as you know, there's a lot of research right now around this question of a third dose, whether it will be needed or not. I think there is absolutely no concluding evidence right now, and there is no concluding evidence whether we will be able to mix some of the vaccines. We know that the mixing of vaccines could really have a good effect on the immunity, but it's against the rules and against the regulatory in most of the countries, and it's something that needs to be well defined before starting a massive use.
So I guess the last question would be, what would you have done differently if you would start this campaign now in Serbia? And what would be your advice to Ukraine in light of that?
I think we got flooded by vaccines and we didn't have sufficient time for preparation. My advice would be that, preparation is really important. As much as you invest in preparing the logistics, training of health workers, communication, particularly, more success you can expect soon as you get a large quantity of vaccines. And that moment will come at some point. Vaccination, if it's well prepared, it's not a big issue. You can do it in a relatively short period of time. Preparation. And as I mentioned several times, we suffered from the bad communication and non-strategic communication from the beginning. I think that's the biggest lessons that we have. We didn't have a huge crisis that would stop vaccination, for example, in the country. But we all need to be very careful and ready for any sort of crisis that may come in this kind of mass vaccination. And we all know that in history, there was no example like this where we vaccinated so many people in so short period in so short period of time. So the risk.
So the only thing to say in the conclusion, that all our colleagues and friends in Ukraine are waiting for you in Ukraine. And since you are a fully vaccinated person, we hope that you will be coming to Kyiv very soon. That's
I hope
what
to.
Colleagues ask me to tell you.
Thank you very much. I would love to. I think as always, I think we all benefit from exchange of experience and information, and we try to learn from each other. I think that's the best way to go. And my best regards to everyone in Ukraine. Get ready and also get confidence in the vaccines. It really works. So even the vaccination is possible. Serbia is not more developed than Ukraine. We're about the same country, same mentality, same kind of level of development. So if you guys take the best lessons from us, you will do it like this. And good luck in that.
Thank you very much. So at this moment, we are going out of this air. Thank you, Pop, very much.
Thank
Всем,
you.
кто нас смотрел, большое спасибо. Ждите нас.
Everyone who's been viewing us, thank you very much indeed. So look forward to more of our airings.